Breath of danger. 10 causes of lung cancer. Every breath you take is a story of life. Air fills your lungs, oxygen travels through your bloodstream, fueling every cell. The lungs, delicate sponges, work tirelessly to keep you alive. But not all air is pure. Not all breaths are safe. Every day, invisible toxins, viruses, radiation and lifestyle choices attack your lungs. You see, lung cancer is the deadliest cancer worldwide, responsible for over 2 million deaths annually. Today, we uncover the 10 major causes of lung cancer, each silent, each insidious, each preventable. Number 1. Cigarette smoking. Smoking is the single largest cause of lung cancer, responsible for nearly 85% of cases. Cigarette smoke contains over 7,000 chemicals, including carcinogens like benzene, arsenic, and nitrosamines. So, these toxins damage the DNA of lung cells. Over decades, mutated cells proliferate, forming tumors. Smokers are 15 to 30 times more likely to develop lung cancer than non-smokers. Even quitting later in life reduces risk. The sooner you stop smoking, the sooner your lungs can begin to repair. Number 2. Second-hand smoke. You don't have a smoke to be harmed. Second-hand smoke carries the same carcinogens. Therefore, non-smokers exposed regularly to smoke are 20 to 30% more likely to develop lung cancer. Children living with smokers face lifelong increased risk. Protection begins at home. Smoke-free environments save lives. Number 3. Air pollution. Air pollution is a silent killer. Fine particle matter, PM 2.5, penetrates deep into lung tissue. Nitrogen dioxide, sulfur dioxide, and ozone exacerbate inflammation and cellular stress. Long-term exposure increases lung cancer risk. Studies show that living in highly polluted cities can be as harmful as smoking several cigarettes a day. Reducing exposure with air filters, avoiding heavy traffic areas, and advocating for cleaner air policies saves lives. Number 4. Radon gas exposure. Radon is a naturally occurring radioactive gas, invisible and odorless. It seeps from the soil into buildings and accumulates in basements and poorly ventilated homes. Radon particles damage lung cell DNA over decades. It is the second largest cause of lung cancer worldwide and the leading cause among non-smokers. Prevention is simple. Test your home and ventilate properly. Number 5. Asbestos exposure. You see, asbestos fibers are sharp, microscopic, and lethal. Once inhaled, they log deep into lung tissue, causing chronic inflammation and genetic mutations. Prolonged exposure leads to lung cancer and mesothelioma. Construction, shipbuilding, and industrial workers are particularly at risk. Safety measures, protective equipment, and proper regulation are essential. Number 6. Genetic risk. Some individuals inherit genetic susceptibilities that increase lung cancer risk. Genes controlling tumor suppression and DNA repair may be less effective. Family history doesn't guarantee cancer, but combined with environmental exposures, smoking, radon, pollution, the risk rises sharply. Early screening and lifestyle vigilance are crucial for at-risk families. Number 7. Occupational chemical exposure. Long-term exposure to chemicals such as arsenic, chromium, silica dust, formaldehyde, and diesel fumes increases lung cancer risk. Workers in mining, manufacturing, or chemical industries are vulnerable. These chemicals cause chronic inflammation, DNA damage, and cellular mutation over years. Regulations, protective gear, and medical monitoring are life-saving. Number 8. Previous radiation therapy. Radiation therapy, while life-saving for other cancers, can increase the risk of lung cancer years later. DNA in lung cells is damaged during treatment, sometimes causing mutations that evolve into tumors. Regular follow-up, early detection, and protective measures are essential for survivors. Number 9. Chronic lung diseases. Chronic lung conditions, COPD, pulmonary fibrosis, or long-term infections cause ongoing inflammation and cellular turnover. The repeated repair process increases the likelihood of DNA errors, which may lead to cancer over time. Therefore, patients with these conditions should undergo regular screenings to detect tumors early. Number 10. Heavy marijuana smoking. While occasional marijuana use carries minimal risk, heavy long-term smoking introduces tar, chemicals, and carcinogens similar to tobacco smoke. Deep inhalation increases deposition of harmful substances in lung tissue. Studies suggest increased risk of lung cancer among chronic users, especially when combined with tobacco. The lungs are the gateway of life, exposed to the world with every breath. Each cigarette, each polluted breath, each exposure to chemicals, radon, asbestos, or radiation leaves its mark. Understanding these 10 causes of lung cancer, smoking, secondhand smoke, pollution, radon, asbestos, genetics, occupational chemicals, radiation, chronic lung disease, and heavy marijuana use is the first step towards prevention. Every breath matters, every choice matters, every environment matters. Protect your lungs, invest in your future, because life is measured in breath and every breath counts.